Hello, hello everyone. And we've got some people joining already. Thank you very much for joining us. I'm just going to try to set up a couple of things and hopefully everything is going to turn out okay. Please let me know. You should be seeing the participants to your right. Let me know. You will have an option for chats. So please let me know if you can hear me well, if you're not hearing me well, if you're having problems with it. The picture is going to change to the presentation when we start it. But for now, I'm hoping that you can hear me well. Please let me know if you do. I'm just trying to make sure that everything is okay. We are recording this session. And thank you very much, Joe. Hi. You can hear me fine, good. If at some point any of you have problems with hearing me, feel free to drop it on the chat. You can put some questions on the chat as well, and I will try to answer your questions later on if you would like to. But during the presentation, I'll just go through everything to try to make it within the allotted time, which is going to be roughly 1 hour, as you probably all know. And then I will try to answer your questions at the end. And if you don't have time for that, I will answer them personally in that case. So far so good. Everything seems to be working well. I will be able to share my screen with you. We've got quite a lot of people around. That's lovely to see. So thank you so much for joining us tonight. I know it's a little bit late, but it's just to try to see if we can have as many people interested in joining live. So we're going to give it a little bit of time, if that's okay for you guys, just to make sure that people have time to join when they're meant to join, which is roughly 9 o'clock. So it won't be too long now. And also, I apologize in advance if I'm going to have some breaks here and there for a glass of water, because my throat is not the best. So I'm going to start that now. We're having more people joining, and as you're joining, I just keep welcoming you and thanking you all for being here. And everyone is really, really much on time. So like I said, we're just trying to make sure everything is set up properly. I'm just making a note that I am going to mute all the participants just to make sure that no one is interrupting by accident or their background sounds by accident. And I also need to apologize in advance if you hear some background noises here, because I'm not alone. And I do have a couple of cats going around, and sometimes they like to destroy things. Hopefully they will not be doing that tonight. But like I said, if you've got any problems with anything, feel free to pop it on the chat. And if you've got questions throughout the presentation, then feel free to pop them on the chat as well. I will just, like I said, sorry for those of you that joined really, really early. So like I said, if you have questions, you can pop them on the chat. I might not be able to answer all of them, but if that's the case, I will then try to answer all of them personally, all right? So let me pull up the presentation and see if I can start sharing my screen with you guys. There we go. So from now on, I will not be able to look at the chat, okay? So I will still be able to hear it if you leave messages in there, but I'm going to turn my camera off, so you've got the entire screen with the presentation, and you can follow it properly. But I will not be able to follow the chat conversation anymore. I don't have to screen yet. Okay, so let me see. I'll be able to share this just now, and we'll get going with our presentation for tonight. And we are going to get that. So you should now be able to see the presentation. There we go. So for those of you who have joined very, very recently, welcome to all of you again to this webinar, which is called Working in Clinical Practice in the UK. And then we've got a little note about, is this for me or not? For those of you who don't know me, my name is Andreia Dias. I am a vet as well, and I work in the UK. And a couple of years ago now, it's been over a year now that I've started UK VetMove Limited. It's not been limited until very recently, but it all started with a website, which is ukvetmove.com, which some of you might know, and that's where this all started. So before we go further with anything else, I just want you to make sure that you know you're getting yourself into for this presentation and you understand if this is for you or not. So I just want you to know who this is for and if this is for you or not. So this presentation should be for you if you are either a vet or a vet student and you want to work in clinical practice in the UK. And if that's the case, you probably have a lot of questions about what clinical practice looks like in the UK. You might not know if you have what it takes to work abroad because you don't know exactly what is valued here in the UK, so you don't know if you have that. And at the same time, you don't know if you can cope with living abroad because you're not familiar with the challenges of living abroad if you've never actually lived away from your own country for a fairly long period of time. So if this is your situation, you're in the right place. Today's presentation is going to cover a couple of things. We are going to cover first and foremost, what's life like on the other side? And the other side is clinical practice in the UK. We're going to go through what a normal day looks like for a vet working in clinical practice in the UK. And I have to make a note that this is based on my own experience, so it's going to be different from place to place. But obviously, it's not something that's been made up. It's the way it worked for me. So you get real example about what looks like working here in the UK. We're going through some challenges and get some clarity about what we face as vets when we work in the UK in clinical practice, and we're going to gain some clarity about how to face those challenges, how to overcome them, and without stressing your heart off, without getting really stressed and too challenging. We are going to ask some questions that will allow us to find out, and allow you in particular to find out, if you have the required skills to work in the UK or not, and if you are prepared to work in the UK and to live in the UK. Now, on top of that, this presentation aims to give you some knowledge that will make you feel like you understand clinical practice in the UK a little bit better, even if you've never practiced in the UK, and if you've never seen practice in the UK, and if you've got no experience in the UK. Finally, we'll try to understand how clients, animals, and colleagues interact in the UK without the fear of you looking bad for some reason. What is it that I'm trying to allow you to take home? The message that I'm trying to allow you to take home is the understanding of what clinical practice looks like in the UK, and that will hopefully give you the tools to develop a thriving career with a high-paid salary, high standards of care, while still being supported to improve your skills even more. And that's what it can look like working here in the UK. So you might be in a position that might match any one of these following statements. You might not know what clinical practice looks like in the UK, and maybe you're thinking about it, but you don't know if the sacrifice of going through everything and moving abroad, even if you're not going to do it for a long time, is worth it, because you don't know what it looks like, you don't know what you might be learning, you don't know what you might be doing. Instead of that, you might not know if your knowledge and your skills are enough to grant your job here in the UK, because You may have heard that it's really hard, you know, the standards are very high, and you may not know if you've got what it takes. On the other hand, you might not know what is expected of a vet in the UK, and maybe you have some people that you can talk about that, but maybe you don't, or maybe the ones that you do will end up not being that helpful. They don't have time, they don't have the right answers. You might also want to work in the UK and you're looking for jobs and you're trying to apply, but you're not getting any replies back. You're getting negative replies, you're getting the wrong offers, and you just don't know what else to do to get the right answers and offers. Or you might be in a situation where you're afraid to move to the UK without a job offer, and because then you're worried that you'll not be able to get a job, you'll run out of money, you have to go back home, and that's going to be seen as a failure. On the other hand, maybe you don't know if moving countries and starting a career all over again, all from scratch, is a mistake for you or not. So you keep thinking about it and you keep, maybe it's not right, so you keep postponing it and you settle for what you have, even though you might not be happy about that. One other situation you might be in is you may want something very specific, you know what it is, but you know you cannot get it in your own country, so you're trying to get it in the UK because you know you can do it. For some reason, one reason or another, you're trying really hard and you're not really getting the results you want. It all comes down to one big worry, and normally this is the big worry that you will try it, you will fail at it, you will not be able to get a job, and then this attempt that you have done will be disappointing, will usually be expensive, will be a mistake, and will be setting you back on your career. However, all of these questions come down to insecurities. They're not exactly the real problem. I feel that usually the problem is that you lack clarity and you don't know the questions you need to ask and answer in order to get rid of those insecurities. So once you do that, and once you get some clarity, you will hopefully be able to answer the right questions. You will be able to understand exactly what you need to do in order to work at the same level of other vets that are based in UK and have trained in UK. You will hopefully know the expectations other people have of you, so you can fulfill those expectations, and even better than that, surpass those expectations. You might hopefully will learn that a career in the UK is something you can cope with or not. It's something that you want to cope with or not, and what you need to change in order to actually be able to do it. And you will gain clarity on the path you can give your career if you work in clinical practice in the UK. We are going to try to approach this a little bit, but if you've got questions about that, pop them on the chat and I will try to have a look at them as well. With the right questions, you will also understand the types of sacrifices that are involved in working in UK, how to overcome them, and with this knowledge, you will be able to create successful job applications. They will highlight your true strengths, increase your chances of getting a job, because you understand what is being expected of you. So, for those of you who don't know me, I did a bit of an introduction at the beginning. And I'm going to introduce myself a little bit further. My name, like I said before, and probably you all know, is Andreia. I am Portuguese and I graduated in Portugal. And I moved to Scotland right after graduation and I started working in clinical practice, and I had very, very little experience. That was because I did all my training with horses and I wanted to be a horse vet, but then life took a bit of a turn, and I ended up working in in mixed practice and doing mostly small animal. So I worked in first opinion mixed practice, and after that I went to spend 6 months on a rotating internship at a referral hospital. And after that, after a brief period where I returned home, I I carried on working in other practices here in the UK, small animal only. And like I'd said, I sort of developed UK VetMove as a bit of a side hustle while I was still working on my very first job. And it all started with website. And since then, I've sort of expanded and worked a little bit more on it. And now I am sharing my experience, my knowledge, my networking, my expertise, and about what I know. And I support other foreign colleagues that want to move abroad. I am now working more and more with coaching, and I'm coaching other colleagues of us to help them reach their lives and career goals without going through the pains and all of the mistakes that I did myself. And when you ask yourself, which you probably are asking, why did I do it? Why did she start all of this? It really all started because I wanted to have had something like that when I started. When I moved, I wish I had a support system that would teach me about how things worked here in the UK before I actually started working here. I wish I had the knowledge of all the things I needed to do after moving to the country, which is also something that is quite hard to find unless you speak to someone that has done it. And then it's things that you learn when you do it. And normally you're already here, so you have to deal with everything. And it can be quite stressful. Most importantly, I wish I had a way to learn about what I was going to see, what I was going to deal with, what I was going to treat in terms of diseases and problems, what was expected of me as a professional when I started working, because I was quite clueless and I had a steep learning curve myself. And finally, obviously, I wish hopefully someone would have taught me how to do job applications, but that was a bit of a learning curve for me. But in the end, I sort of nailed it. But it was after trial and error. And unfortunately, when it happens like that, sometimes you're missing on the good jobs, on the job that you really, 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 really want, because you just didn't know exactly how to apply for that one in particular. So without further ado, we're going to dive into the topic of this webinar. And we're going to start by looking at the working day for a vet that works in clinical practice. And we're also going to cover the types of cases that we might see. We are then going through some questions for you to ask yourself, so you can think about them, so you can decide whether you can do this or not, whether you want to do this or not. That is very important, because you will probably find at the end of this presentation that you can do it. The question is if you want to, so if you should do it. So with these questions, we'll try to understand this, and it's going to be personal. It's going to be for one of those things that is for each and every one of you. And we're going to try to work on those answers, but like I said, it's one of those things that is personal. It's for you to think about. And I'm just trying to point out some questions for you to gain some insights. By the end of the presentation, I want you to feel, and obviously you will let me know if that was the case or not, that you've gained clarity on what you might face as a vet if you work here in the UK. And hopefully, I'd really like that this presentation serves a bit of a purpose of empowering you and allowing you to feel more confident, and that will in turn improve your chances of actually getting a job abroad if that's what you're looking for right now. So before we start to look at what it looks like in real life, I wanted to put this slide in, and I put the title, Where You Get Confused. And this is just a collection of some things that some people know and other people don't know. For some of them, it might be the very first time they're seeing this, or they're wondering about this. And for others, they would have heard about it, and they might still be confused because they might not know the right answers, or they get conflicting answers from people that are working in the UK. So the first thing that I'd like to discuss are surgery requirements. And by surgery requirements, I mean doing surgery. In the UK, a general practitioner, a veterinary surgeon, is called, like I said many times, veterinary surgeon for a reason. When you finish your degree, you are capable to perform clinical and surgical procedures. So vets here will do surgery, even if they are not surgeons in the sense that they have done a lot of training for surgery. So because every practice does surgery in the UK, which in principle then means that every vet does surgery in the UK, some people might be wondering, right, can I actually work in the UK if I don't want to do surgery? And the thing with this is the word here is want. You can work in the UK if you don't want to do surgery, provided that you are confident that you can actually do surgery. What do I mean by this? If you are not able to do surgery, if you don't do surgery, if you don't know how to do it, if you're not confident with it, then you will really struggle to find a suitable job. You will be able to find those jobs, although sometimes not in the most ideal environment, because most people actually do want to do both things, surgery and consulting. So you might have some places where they are happy that you don't do surgery, but that role in itself is going to be a difficult role to find. You can, if you have experience and if you are more advanced, opt for jobs that are consulting roles only, but those are often not long-term jobs. They tend to be either temporary jobs or part-time jobs, so those types of things. So to put it shortly, you can work in the UK if you don't want to do surgery. You just have to be very careful with what you're choosing, and if you do not have clinical experience at all in the UK, that will make it quite hard for you. The next subject that I have here is entitled Demanding Working Patterns, and this is one of those things that you might or might not be aware of. Now, I also know demanding is a bit of a word that's a bit tricky, especially considering the country you're in and where you come from. But what happens in the UK is that working patterns tend to be demanding in some areas and might be more demanding than what you are used to. And you will hopefully get a bit of an idea of what I mention by this, what I'm trying to say with this, as we go through the presentation and as you go through what the day looks like. It can be a job where you are working very long hours and for periods of time that are close together. You don't have a lot of breaks. Now, at the same time, I know that in some countries, you might already be experiencing this. In other countries, however, you might not be working night shifts and you might be just doing a consult here and a consult there. You might not have a very busy day. You might have one surgery or two, and that's about it. So even though you have a long day, you don't have a very hard day. So people then need to consider what type of working pattern are they looking at, what should they be expecting, and then are you willing to spend that much time working? Are you dedicated enough? Do you want to go through that? Or is it too much and would you rather have a different working pattern, and that means you need to look for a different job or a different place? The next topic I have here is about common clinical problems. And this is something that some people just tend to have a bit of a question about whether the problems that they see in the UK will be similar to the ones that they see back home. And would they be treated the same way? Are they different? Is there something different that they don't know about because they've not seen it because it's not common? And you then have to wonder if you're able to deal with the clinical cases that you are most likely to encounter. The next topic is about consults, and I have a note here about short consults. And this is one of the things that you might not know if you don't have anyone in the UK that can give you this sort of information. Typically, consults at veterinary practices are made by appointment, and that means they have an allocated time slot for them. And in most practices, that time slot is about 15 minutes. In other practices, they will make that a little bit longer, and you'll have 20-minute consults or 30-minute consults. And obviously, if you are working in a referral environment, you might have even longer than that. Or if you are working in a specific area like behavior, you might have a much longer consult time. But some practices will also have a shorter consult time of about 10 minutes if they're very, very busy. So this then poses a question, because many other places are not based on appointment consults away from the UK. And then you have to start to wonder, right, short consults, how short are they? Can I do that? Am I comfortable with doing that? What happens if I'm not able to do that? Is the management going to be really mad at me because I'm not I'm spending too much time on them, or is it going to be okay? So those are other questions to pose regarding this. The next topic is about support, and again, this is a big question mark, and this is where you've got a lot of different answers, because it also depends on the particular situation that you are in. And many people, and probably every single person that either comes to the UK or starts working in clinical practice, wants to feel support and wants to have support. And let me tell you, it is fundamental. It is one of the most vital things that you should look into when you're looking for vacancies. Having support will allow you to build up your skills, will allow you to build up your confidence. And obviously in the beginning, you probably want more support, but it's always good to know what support you need, what type of support you actually need, what does it look like for the practice and for your other colleagues. And then you have to find out if the practice actually offers any support, and if they offer what they are saying that they offer. And finally, there is a subject here about teamwork, and that is because the veterinary team is a broad concept in the UK and includes more than just the vet, as it probably is the same in your own country, although tasks and responsibilities can be quite a bit more separated and delegated in the UK. And then you have to sort of understand who's part of the team, what roles they have, can you work well in a team, how do you delegate, who can you ask to do what. And so there's a little bit of learning involved here as well, and many things that you learn by experience. But I wanted to put this here to give you a bit of an overview of some questions and some problems and some common subjects that tend to pop up when we talk about working in clinical practice in the UK. So without further ado, let's actually see what it looked like for me in my own case. And like I said, my case is my case. You can see the practice here in this picture, and this is a practice in Scotland. It is a practice that is mixed and does mostly small animal, but also has a fair bit of farm animal, mostly cattle and sheep, and also has a small amount of equine work. It is a fairly rural practice. There are no other practices probably within a 5-minute drive one way, and a long drive the other way. And it is a fairly busy practice. It is in a small town, but it's been established for a very long period of time, so everyone sort of knows the practice. This practice also covers the own out of hours. That's what the OOH stands for. And that means that when the practice closes, there is always a vet that works there that has the phone and will pick up the phone in case of an emergency and in case someone calls the practice. The practice, as you can see here, has this sort of 2 buildings that are connected, and it has 2 consulting rooms that can be used at the same time. It has 1 prep room that can sometimes be used as a consulting room if the other 2 are taken, and if it's a short procedure, if it's a dirty procedure, or if it's something along the lines of a stitch up that's going to need to have some sorts of procedures done, might go straight through the prep room. If it's an emergency, we'll go straight into the prep room, which is separate from the rest of the building. So the owners, unless they come in with us, they do not go in. And that's because in the prep room, we've got the facilities to provide oxygen, to intubate, and do all those things in case of an emergency. The practice has 1 surgery theatre. It has dog and cat wards that are separate. And in terms of equipment, it had a digital x-ray, it had an ultrasound. It also had a room that we called the large animal room, which you can see here on this picture on the grey door. That's what the large animal room was. And this was a room that had different functions, but it was large enough that we could make pens where we could put calves and sheep that were not doing well and needed treatment and needed fluids, for instance. who was working here. This practice had 3 vets in total, and still has 3 vets in total. When I started, I replaced a senior vet that was aiming to retire, and he eventually did it. But in the beginning, he was my backup. So he spent a lot of time there in the beginning until I got accustomed to things, and it was still my backup when I was working on call. And if I needed help or if I needed advice, he would be the one that I would call. On top of the vets, we had nurses. So we had SVNs, student veterinary nurses. The practice is registered to train student nurses. And obviously, as time went by, they went from students to registered nurses, RVNs. So the number changed a little bit. We also had some support staff that didn't have any sort of accreditation and wasn't a nurse or anything like that, but they were those type of people that have been working in the area for a very long time, and they've got lots of years of experience, and they knew what they were doing, so they knew how to monitor anesthesias, even though they didn't have a qualification. And then we had receptionists as well. The number here changes 1 to 3, but that's because some of these receptionists had this supporting staff functions as well, so they weren't just doing reception work, and that includes the people that were doing accounting as well. How were we working? The rota was meant to be about 4.5-day week, and that meant that over the period of 7 days, we would in theory work about 4.5 days. You will find that many other practices will offer less than that, will offer a 4-day week, which is great. In this particular case, we were doing on call, like I had said. So about 1 in 3 nights we were working, or we were on call. We might end up working during the night as well. The way that they made the early finish, the rota work as a 4.5-day week, was by providing early finishes or days off during the week. So we would have that time available. And the nights, even though they were 1 in 3 nights on call, it wasn't necessarily 1 night on, 2 nights off, and you will understand that a little bit more as we go through. It was a bit more complicated system that in the end would allow us to do, in average, 1 on 3 nights on call. What type of clients were we seeing? Now, this is where you might find things a little bit more interesting, because you might be expecting very well insured and very wealthy owners. But actually, in this case, in this situation, most of our clients were having middle to low income, and we did have a couple that were very well insured, or the owners had high income, or they had savings that they would invest in their animals. But the majority of them had middle to low income, and some of them were even on benefits, and that meant that they were actually eligible for charity support, which made it a lot easier for them because they could afford the treatments and because they had the support. But it also made it a bit more tricky on us because we had to be very selective of those treatments, and we had to be careful with the choices we were making. So we had 2 different days. The way this practice worked, we basically had a consulting day, or we had a surgery day. So we're going to start by looking at what the consulting day looked like. It started at 7:30 in the morning, and then what happened was that you had consultation slots up until 10 a.m. Now, this would result in 6 consults if all these slots were filled, which would not be too common, but would not be too uncommon. So it could well be that by the time you're 1.5 hours into your job, you have seen 6 consults by now. Some of them very easy, but some others might not have been so easy. So this is the questions you have to pose to yourself and try to answer. Do you think you have resilience to work at this sort of pace? Do you feel you need to start slower? How much slower do you think you start? How much support do you think you want, and what type of support do you want on this particular situation? How long do you think it will take you to feel confident enough to deal with these consults with this allotted time? After that, I want you to approach some of the common problems that are seen in consults. And I just pointed out 5 common things that we would see in that particular situation, and not all of them, as you see, are problems. So it would be extremely unlikely that a day would go by that we would not see a case of vomiting and diarrhea or skin/ears disease. There would always be an animal with vomiting or diarrhea, or a dog or a cat with itchy skin or with sore ears. And that is very, 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 very common. The other thing that we tended to find in that practice in particular is that we had a lot of clients coming down to get their animals and all that done. And then we also had quite a lot of cases of lameness, either older animals or trauma. Again, probably because it was more of a rural location where animals were running around. And then obviously we had boosters, vaccinations, and annual health checks to be done. So when it comes to these problems, they are common, but they are nowhere near everything that you see, obviously. And as you can see, that only 3 of these things are clinical problems. But still, you have to think about what you're able and happy to deal with all of these problems, and if you're happy with what you do and with the treatment that you do. And if not, what is it that you need to work in? And those questions will allow you to gain more confidence when it comes to consulting, because you might be in a position where you might be working already in your own country, and you are probably seeing this, and for many of these cases, the approach is going to be similar. After those consulting slots, we would have a bit of a break time, about 10 o'clock, and that was a bit of a time for us to try to get some food, tea, which is a very British thing. We would hopefully have some time to read, or not. That would be the time that was used to book in home visits and farm visits. This was a time we used to catch up on things, to call clients that are wanting to speak to us, to get results from samples that were sent away, to update the records, to prepare samples to send away. You will see as we go through the surgery day that there is going to be a surgeon at this time that is performing surgery. And if it's very busy, we might be working with them to help them. On the other hand, very commonly, there would be other patients that were either admitted or had a problem or needed investigation done and were inpatients. And this was the time that we used to work with those patients. We either had to do fluid readjustments if they were on fluids, if they needed blood testing or blood sampling, that's when we would do it. If they needed any x-rays or ultrasounds, this would be the time when we do it. So it could actually be a fairly busy time anyway, although most of the time they did have a bit of food or some tea. So right before lunch, between 12 and 1, there would be another 4 consultation slots available. Now, I should have mentioned this before. Each consultation slot is a 15-minute slot and is scheduled for a consult room. So that means that between 12 and 1, because we've got 2 consulting rooms, we can actually see 8 animals. Now, these slots were not very popular, so most of the times we didn't see many things at this period of time, but we have to be a little bit careful when we did have this, because there would be 3 of us or 2 of us if someone was off, and we would have one in theater, probably doing surgery, and the other one could be out in farm calls, or could be doing workups with the patients, and sometimes we had more than one patient. So if we had something at this time, we had to be a bit more careful to make sure that we were free or there was someone free. And usually we were a fairly good team. We could organize it in a way that we tried to have someone free to see the case that was coming down. And then we had a nice lunch break, about 1 hour, if we could use the full hour, and normally not such a healthy lunch as this one, more like a sandwich. Some people were good at cooking at home, but it wasn't particularly my case. After that, we're back on track for the afternoon, and we start again consulting between 2 and 3. And again, we've got another set of 3-minute consults. So for this, you are in a consulting room, and you can see another 4 patients. However, now this time, it tends to be quite busy. So normally we've got all the slots filled and the 2 consulting rooms taken. So you've got lots of people outside in the waiting room, and things are starting to pile up a little bit. So you start to feel a little bit of pressure, and you have to see these cases, and you have to get going with them. start to wonder, can I work quick enough? And then obviously there's always the thing with these consults that you tend to have easy consults most of the times, but you can have tricky consults that you cannot do in 15 minutes. If you've got a pyometra, you cannot, unless you are really experienced in this, you cannot really get a physical examination and get a history and get a diagnosis and discuss all the implications and discuss all the possibilities for treating a pyometra, and then discussing the agreed treatment and getting consent for all of that in 15 minutes. So that means that if you are in this situation, you will hopefully be confident enough that you're in a place that is going to cover for you and is going to help you with that and is not going to point at you for being so slow. And this was the good thing about having two vets, and something to consider, which is if you see the other vet is having the tricky case and is taking its time because it's not an easy case, can you speed up on the easy cases? Can you do a booster in 7 minutes instead of 15 minutes and help your other colleague? So again, are you prepared for this type of pressure? And are you ready to live up to it? So after these busy consult times, we would then have a bit more of a break time where we would think, finally, we can sit down, we can have time to breathe. And most of the times we did. Occasionally, we had to go to home or farm visits that had been booked as a bit more of an emergency. And most of the times we did some sort of catching up on this period as well, writing notes, preparing medication, getting prescriptions done, getting things signed, speaking with people that were calling earlier and wanting to speak to us, those types of things. So we could have a bit of a break, but most of the times there was something else to be done, especially, for instance, if you had been on farm call in the morning and you had a lot of bloods taken, this is probably the time you're going to get them all ready to be sent away. And after 4:30, usually there would be one vet early, and that was leaving early, so there would be only 2 people most of the times. And between 4:30 and 6:30 to 7:15, we'll have another go of 15-minute consultation slots. And they, again, were very popular and can also be quite late and quite busy because it also tends to be when people come around and they come home after work and they found a problem with their animals and they've called in and they're coming down. And when you are really, really busy in this situation, you can see up to 10 consults in a row without stopping, by which point usually you might be thinking something along the lines, are you actually still going to be alive at the end of this day? Because you've been on your feet, working hard, talking all day, discussing cases all day, seeing patients all day. So it can be a very long day. And believe it or not, as you have seen, this looks like we've been doing procedures and it looks like we've been addressing cases, and we've been doing a lot of thinking, and like I said, we've been doing a lot of talking, and that is why communication is so important. During this time, a vast majority of this period, at least something along the lines of 50% of the time that you've been consulting, you would have been chatting to the owners. You'll be asking questions, you'll be discussing findings, you'll be discussing options. There's a lot of hearing that you have to do and listening that you have to do, but you also need to do a lot of communication, and that is very fundamental for you to understand. So are you feeling confident enough with your skills when it comes to communicating, or do you want to improve them, and how are you going to improve them? So that was the consulting day. If we were working on a surgery day, we had some different challenges going on. So what would happen is that usually there is one vet that is going through the surgery day, so the vet does all the surgeries, and the other 2 vets are doing consults. So if you were working on a surgery day, you would start at the same time at 8:30 in the morning, and you'd be admitting the patients for surgery or for procedures, other procedures that were going to be done between 9 and 10 o'clock in the morning. Then we would be examining those patients and organizing the surgery, see which one goes first, which one goes next, and doing all the pre-op bloods, preparing pre-medication, preparing sedation for these animals. And this, for me, was the most challenging bit because there was a lot of things that were going on that I had very little confidence to do when I started. And you have to start asking yourself, if you have this work and you have a nurse to help you do this work, and this is where they really, really help you, you still have to consider if you know pre-medication protocols, sedation protocols. Are you happy with using them? Are you happy sedating your patients? Can you do IM injections? Can you place IV catheters? These are things that your nurses can do for you and can help you with, but you still have to make the decisions. You still have to decide the drugs. You still have to decide the doses. Can you read the blood that you've just taken for that patient? What are you going to change if the bloods are showing something wrong? So there's a lot more things to consider in this situation. At least for me, I felt there was a lot more that I was not particularly comfortable with. So it made for a very steep learning curve, because it was something that was being done very often. You would have a surgery day normally 2 to 3 times a week. So it was something that was being done very frequently. So once you've got that set up, you've got your medication ready, you have to pre-medicate the patient, and you start your general anesthetic. And there you go. There was something else that I was not particularly comfortable with. And you have to think about this. Are you comfortable with inducing anesthesia without supervision, without having someone there to tell you it's okay? Can you then intubate dogs and cats with a high degree of confidence and knowing that you can do it yourself, and you're not going to have to shout for someone from the other end of the practice to come over and help you? Do you know what to do if things go wrong with what is happening? Do you even know what it looks like if things go wrong? Is that dog not breathing just because you gave it too much propofol, or is there something else going on? Do you have to get some equipment that is not ready to make sure that you monitor things properly? So this was a very challenging for me, because I didn't have confidence, I didn't have practice with anesthesia, with sedation, or with surgery. So I was a bit out of my field. But I was very lucky that I was in a place that really helped me through everything. So once you go through the bumps of inducing your anesthesia and you've got your patient under anesthesia, you now have your nurses monitoring your patient. So you have to establish communication with the nurses and with what they are doing, and they have to establish communication with you about what they are finding in the patient. They are monitoring, but you are still making the decisions. If there's something going on, they will tell you, and you have to decide on that. While they are monitoring your patient and preparing your patient for surgery, you are getting ready for surgery, and you will then be performing the surgery, usually on your own, unless it's something a little bit tricky and you are asking for help. Normally, we would have 1 to 2 surgeries per morning. We would have more if they were something simple, like if they were cat spays, we could have 2 cat castrations and 2 cat spays in one morning, for instance. But we would avoid having more than 2 dentals, for instance, in one morning. Our routine surgery, it's mostly what I did, includes spays and castrations, includes dental scales and polishes, and that always includes possible extractions. That's always on the table. And even though it wasn't as common, we also had lump removals, we had X-laps, we had gastrotomies, we had some limb amputations, and we had eye enucleations and things of the like. So more routine things. In the practice, we could do more specialized surgery, which I wasn't comfortable and happy doing myself, but I would assist with. These are the type of surgeries that you normally need someone else to help you, and those would be surgeries for fracture repairs, cruciate ligament repairs, luxating patellas, enterotomies and enterectomies with anastomosis. So usually in this situation, you would have a second vet helping you, or you would get one of the nurses to scrub in and help you. We also did emergency surgeries. They were way more common during the nighttime, but they could happen, any of them could happen during the day. And as a matter of fact, quite a lot of these surgeries took place during the day. And those would be the C-sections, the cesareans, the GDVs, foreign bodies, and not commonly, we would have to sometimes do splenectomies due to splenic masses and resulting hemoabdomens, although that wasn't so common. But these were all things that could have happened during the day or during the night, And as a matter of fact, I did C-sections during the day, I did foreign bodies during the day. GDVs actually didn't happen during the night, but I think that actually reflected the population we had in terms of clients, where we didn't have a lot of clients that were predisposed for GDVs. So these were the type of surgeries that we were doing. And I had zero clinical experience when I started, zero surgical experience when I started. And I was really lucky to be in a place like this, where I started by going into surgery with someone that was doing surgery and helping them. And then I followed that by going into surgery myself, being the main surgeon, and having someone else to help me and guide me and making sure that I was doing things correctly until I was comfortable enough that I was doing that myself. And this practice was very good because I was just fresh out of vet school, but so was one of the other vets that was there. So there were two of us that were just beginning, so we were quite supportive of each other, and it really does help when there's two of us and we're sort of on the same path. But at the same time, it also highlighted me that she had a way more experience than I did, hands-on experience, especially when it came to surgery. She was used to doing surgery herself, so she started by doing surgery on her own, while it took me time to get to that point, but I eventually did. So when it comes to surgery, we're going again to this question: do you need to do surgery, and can you work in the UK if you don't like surgery? So you can work in the UK, like I said, if you don't like surgery, provided that you still can do surgery and you would be able to do surgery if it was really required. And that means that you are still sort of in a similar level than the other people that are working in the UK. So you don't need to do surgery, but it is really beneficial for you to know how to do it, or to be willing to learn how to do it. And this is when you have to think about the type of support that you will need to get it going and get it done. Because like I explained, I was in a place where I was able to build up my skills to become confident with them. And I went from, like I said, not doing anything at all to feeling confident in doing surgery on my own. Not all of the surgery, and I was very quick to ask for help if I was having trouble, because I would rather get someone on board on time rather than making a mistake that was going to be costly. But I was in a place that had this support. So if you are not so confident doing surgery, you want to make sure that you're in a place that is not going to let you loose, and be unable to support you when you need. So we've done surgeries, we've finished them. Our patient has woken up and is recovering. The nurses are monitoring our patient, and this is the time we used to write clinical notes. And after that, we will have our lunchtime. Usually there would be no specific timing for that. We would have lunch when we finish the surgeries. If we were lucky, this would happen early. If you were not so lucky, you would be eating a little bit later. So between 2 and 3, like I said before, if you're lucky, you've had your lunch. You don't have a lot to do. You have to finish your clinical notes for the procedures that you've done. You have to make sure your patients are doing well. You will usually be updating the owners on how the patients are doing. And between 3 and 4, if you remember, this is going to overlap with the period of time that we finished our consults, and there's a consult break. And this break is for all the vets, where again, you've got a bit of a break time. You've got some time to catch up with the other cases, or do some work, or do a catch up with the notes and so on for other problems that you've been seeing, not necessarily during that day. So now what happens is that usually one of the vets leaves, and the person that has been doing surgery is going to start consulting between 4 and half 6, quarter past 7. So there will be more consulting work, 15-minute consults, as well as discharging the patients. Now, obviously, the receptionists were nice, and if they booked a discharge, they would not book a consult at the same time. So a discharge takes a consultation slot, and therefore you've got 15 minutes to discharge your patient and speak to the owner about everything, about what happened, about the complications that they could be expecting after surgery for the recovery. And this is something that some practices, you will have the nurses do it, but in this one in particular, the vets like to do it, and we did it ourselves so we could speak to the owners. Because what happened was that usually when the practice closes, the person that has been doing surgery will stay on call until the following morning. And what that means is that we get a phone, we get a mobile that is a work mobile, and that anyone that calls the practice while we are closed gets diverted to that phone, and the vet that's got the phone has to answer the phone. So we've got that phone, and the basis for that was actually quite smart, was that if someone really has a true emergency, it's either a true emergency or it might be one of the owners whose animals had surgery that day, and there was something a bit unusual, or they've got doubts, or they're not happy, and therefore when they call, they're actually reaching to the vet that has done surgery. So at the practice, they just thought it made a bit more sense. And as you see, the surgery day is a little bit different from the consulting day. And you go from surgery to consults on the same day. So you have to then think in this situation, are you willing to work doing both things? Can you switch your approach? Can you go from doing consults and then doing surgeries, and then you're not doing consults anymore, you're doing a discharge, so you have to go back and forth, and it's a different level, and it's still it's still hard work, but it involves slightly different adaptation skills, because you're going from one thing to the other. The next thing that you would be doing if you were doing surgery on that day is normally you would be then having the on-call and the after hours. So what did it look like in this particular practice? It actually was extremely variable. We could have no calls at all during the night. We could have no patients admitted overnight at all. We could have nothing in, or we could have several people coming down with emergencies at the same time, or we could have patients that had been admitted during the day and that needed treatment. So the person that is on call will also be looking after the inpatients, and these are normally patients that are on fluids for some reason and on top of other medication. So what we did was we checked the patients before leaving the practice. We would then check the patients before bedtime. This was at our own discretion, depending on how stable the patient was, and therefore some not very stable patients required further monitoring. So it was not all too uncommon for me to get up at 4 o'clock in the morning and leave my house and go to the practice just to see that the medication had been given, or the animal had not vomited even more, or that everything was looking okay. Some other patients would need very frequent checks. If it was a patient that was seizuring, if it was a critical patient that had been an RTA and was on oxygen, if it was a diabetic patient that was going dangerously low on the blood glucose, and we had to keep giving glucose to make sure it wasn't going hypoglycemic and was needing checked very often, every 2 hours or more, then I would not bother leaving the practice. I lived maybe 3-minute drive away from the practice. But even in that situation, I just prefer to sleep in the practice to use more of the time. Then if we had any calls, we would be seeing the emergencies. And again, that would be at the vet's discretion and whether the owner wanted to come down or not. And sometimes we did have real emergencies. We would have seizures, we'd have animals with dyspnea not being able to breathe. We would sometimes have RTAs, road traffic accidents, other problems that required surgical intervention like C-sections and GDVs. But most of the time, they would not be particularly real emergencies. It would be cases of, say, an animal vomiting blood, or an animal with horrible diarrhea, but the animal is still running around. Or you'd have owners calling and saying something along the lines, he's just not himself, he's breathing funny, he's walking funny, he seems to be in distress, and you don't really have anything. But you can't really triage them over the phone, and you end up having to see them just to make sure you're not missing something really bad. So the out of hours would be something that would be highly variable, and we could have some very lucky nights and weekends, because these involve the weekends as well, or we could have some not so lucky. And it could happen that you were working overnight, and in the following day you had to go to work again in the morning. So when it comes to out of hours, you need to think, if this is the case for the jobs that you're applying for, Do you actually want to work out of hours and or on call? Are you used to do it? Are you prepared to see these types of cases, because there are different types of cases? Are you going to need backup if you've got problems? Will you have backup, and who's going to be your backup? Are you going to be able to speak to a vet, or are you only going to be able to call a nurse to help you with an anesthesia if you've got a surgery? Do you want to work with inpatients, but you don't want to see any emergencies? These are all things that you need to consider when you're looking for jobs, because you don't want to get jobs that have the wrong specifications for you. Now, there are many places that do not work on call and do not have out of hours. And again, that is something for you to decide, because the work is different, and you will be seeing these cases if you work out of hours. You might be way more unlikely to see them or deal with them if you don't do out of hours. So you have to play it depending on what you want to do. Out of hours, personally to me, has given me a lot of experience and a lot of confidence to deal with cases that are emergency cases, and they are the real emergencies. And you get to learn and you get to see them. It's not just seeing a dog that's been vomiting. You are seeing a dog that is collapsed and needs intensive care for you to save him. So you need to work on different skills than if you're just doing consults. So I personally found that very useful, but other people might find that too stressful. And they might not be willing to do it at all if they don't have the right support. That is something that you need to consider for yourself. See if you are in a position where you're happy to do it, or whether you want to do it, and the type of support you're looking to have if you're doing this. So to go back to what it looked like for me on my first job. During the consulting days, we would be consulting during the entire day. We would sometimes need to work in patients, especially if we had seen something in consult that needed to stay in, or needed to have fluids, or needed to have an ultrasound. Then we would tend to try to work those patients. During surgery days, we would be doing surgery in the morning, and then the afternoon would be filled with discharges and consults. If you were on call, which would usually happen when you were doing surgery, you then will have the early finishes because you are on call. So you're working the full day, and then you're working on call during the night. This on call, like I said, was quite variable. You could have nothing at all, or you could have several calls and several patients coming down at the same time, or at different points during the night, during the weekend when you were also working on call. And this tended to be a little bit worse during springtime, when it's calving and lambing season, and you've got all the babies being born and all the farmers with the emergencies. But when we were on call, we would work the following morning, whether we had work during the night or not. So it was not, it was possible for us to have a surgery at 2 o'clock in the morning and wrap up that surgery and go to bed for 2 hours or so before coming back the following day. Now, many places avoid doing that, but this depends on the amount of on-call that is done and on the amount of staff that they have, obviously. They were, however, fairly flexible in the way that if we had had a particularly bad night, they would try to let us go earlier. And normally, if we were on call, we would have an early finish the following day. So that was to try to make things up easier for us. So, like I said, we would have early finishes and days off, usually one afternoon or day off at least once a week. Usually, if we were on call, if we had been on call during the night, we would have tried to have an early finish the next day, so that we could catch up on some sleep if that was necessary. So after this, you now have an overview of what it looked like for me when I was working here on my very first job. And like I said, each job is different. Keep in mind what type of job this was. You could have a look at what type of procedures that I was doing, what I was performing in terms of consults, what I was seeing in terms of consults, what I was doing in terms of surgery, the type of demands that we were having. You can see what it would look like if you were moving here, and obviously some of the sacrifices involved. If you're sleeping in the practice, you're not sleeping at home, if you're working overnight, and what the knowledge and the skills that are seen as strengths for vets here working in the UK. So now you can apply them to your case and see if they are your strengths or if you need to work on them as well. This now poses the big question, the last question we have in our presentation for today. And this is the question about whether working in the UK is for you or not. Now, you've seen the type of caseload that we had. Not every practice is the same. Not every practice is as busy as that. Some other practices are even more busy than that. Are you excited with this? Are you excited with the idea of having such a caseload and seeing and working up this caseload? Are you interested in working in both your medical skills and your surgical skills, not just one of them, but both of them? And these answers, together with the answers you've been getting so far with the previous questions, will help you decide not just about whether this is for you, but whether it's something that you want to do and you're going to get a benefit from. However, there is one question that I can give you the answer for, and this is the million-dollar question. You have to ask yourself, are you willing to learn? If you have a current mindset where you are wanting to learn, where you are wanting to improve, where you are willing to change what you're doing in order to do it better, then you have the right mindset and there is a place for you in terms of job when it comes to clinical practice in the UK. So for this question, there is no other answer apart from yes if you want to work in the UK. You have to be willing to learn, you have to be willing to adjust, you have to be willing to make changes if you want to work in the UK. If you do not want to learn, if you do not want to improve, if you're happy where you are, then you probably will struggle heavily to find a place in the UK that is going to satisfy you. So this question, if you are willing to learn, you have a place in clinical practice in the UK. The rest of the questions allow you to decide whether you want it or not, whether you should go for it or not. And that's your decision, and that's on your professional development. It's about what you want to do, and it's about the life that you want to live, not just in terms of profession, but in terms of life itself. So what's next after these questions? You had some insights, and hopefully you'll now have some things to think about, and you might decide that you want to come to the UK and you want to work in the UK. If that's the case, you only have two ways to go about. You either stay where you are, you keep learning, you keep searching for things, and you keep trying to get more certainty, but you'll probably never know enough, never have enough, never feel confident enough, so you're just going to stay where you are. If you're unhappy, if you're unsuccessful, if you feel like you can do more with your life, you will just stay there if you take no action. That's what it's going to look like. Or obviously you can do something about it. You've decided that you want to work in the UK, this is for you, so you commit to it. Instead of thinking, what if, what if, what if? And you take the if away from it, you commit to it, so you get to actually do it. You get to see interesting cases. You get to feel that both your medical and your surgical skills are improving. You're being well paid, you can live a comfortable life, you're being respected, you're a valued member of society. So you take it from the imaginary, you take action, and you commit to it. So if that's your case and you've just decided, yes, that's it, I'm done with being where I am, I want to change, I'm going for it, you then might be wondering, can you get help with it or not? Then the answer to that question is yes, you can. So what I've done was over next week, actually over the next 2 weeks, I have some slots available, and you can book a strategy call with me, and we can go through these questions for your own particular case, and go through these answers, and then we can try to see what your problems are, what your situation is, and what plan of action you would take in order to actually make this happen. So we would be covering your own situation and developing a plan for what you want to do. And again, this is for those of you that have gone from the sidewalk and just looking at things and thinking about them to those that have decided that they're going ahead and they're going to do it. Then you might be asking, right, do I need to pay for this call and so on? No, you do not need to. It's a free call. We can do it on Facebook. We can do it on Skype. It's for free, but it's not for everyone, and it might not be appropriate for your own case. So pay attention to this. If you have decided that you want to come over to the UK and you want to work in the UK and you want to develop yourself, your skills, both professionally and both technically, then see if this applies to you. Okay, so this call is for graduate vets or those of you that are just about to graduate, probably within the next 2 months or so, from a European country. And nothing against non-European countries, but the European countries are the ones that I have experience with and the ones that I'm familiar with, and the one that people from these countries are the ones that I can help the most. This is for those that have decided that they want to work in clinical practice. They're not thinking about it, they have decided that they want to do it. It's for people that are happy with their current level of English. They're happy that they know enough, they're able to communicate well enough, and they don't have to take any extra courses or not. It's for those of you that are hardworking and, like I said, willing to learn. You have to be willing to learn. This is also for those that are willing to invest in their future career and their professional skills, because obviously you'll be investing your time on this if you want to arrange a call with me. So you can do it on this link that I've got here, and I will pop it at the chat at the end of the call. And the link is www.ukvetmove.com/book-call. You don't need the rest. You can have the rest, but you don't need the rest for that. And on this page, you will be able to see a calendar when you can book a suitable time. So you might now be wondering why I'm doing this, why am I offering my help? And as you probably understood from the very beginning when I presented myself, I am really, really passionate about helping other colleagues avoid expensive mistakes, disappointing mistakes, setbacks in their career, like it happened to me, just because they don't have the right knowledge, just because they don't have the right support, just because they are making decisions without understanding what's going on, because they've got no one to help them with. And like I said, this was something that I have created because I wish to offer the guidance and the support I wish I personally had myself when I went through this situation. Now, obviously, as many of you actually also know, I do work with vets on the topics that normally are approached on the calls. So if it's suitable for you and if you're interested, if you like the approach we take, you might want to go ahead and talk about what it would be like for us to work together. Okay. Now, no matter what, it's just a call where we talk about your own situation, and you will hopefully get quite a lot of value from it. And whether you decide to work with me or not, that is not part of the deal. Okay. So the calls are about you. So there's quite a lot of questions to discuss your own situation. So I'm going to leave this link here for you. The session can be booked at ukvetmove.com/book-call. And on that page, you will find that there is a couple of calls that you can choose from, but you choose a strategy call, which is the one that has no cost associated with it. And after that, you need to select your time zone. So be careful with the time zone. Make sure you select the right time zone for you. Otherwise, you might end up putting a time zone that is not suitable for you, and you book in a certain time, and you might not be getting the time that you think you are. And after you've got your time zone, you then get a calendar where you can choose a date that suits you, where you can choose a time that suits you, And after that, you will actually find some questions that will just help me understand your situation a little bit better before we call, so I'm a little bit more prepared. And after that, you get an email with a confirmation. You can reschedule your call if you want to. And like I said, it can be done on Skype. It's usually how it's done, but you can choose different, you can choose to do it on Facebook. As long as you let me know, I'm perfectly fine with that. So I do have a couple of slots over the next 2 weeks that are reserved for you. But you will see that each one of them does take a full hour, so it's booked for 1 hour. And we, like I said, we were going to discuss your own situation, and that is going to involve a lot of questions to understand what you want and what your problems are in particular. So feel free to check that out. I'm going to pop the link on the chat for you as well. And it will hopefully be something that will give you answers and even more clarity about your future career. So before we go, I would just like to thank all of you again for being here, for taking time to stay through the presentation, for taking the time to listen to me at this late hour. I just wanted to leave a couple of links and information for you. So the website, which you can see there, and you've heard me talk about it. And there's also a Facebook group for those of you who don't know about it. Many of you will, because it's been shown there. But for those of you who don't, this is the Facebook group here. And you can also find me on LinkedIn. So feel free, if you are on LinkedIn, feel free to connect with me. And feel free to let me know you're there as well. And what I will do just now, I'm going to try to stop this. So forgive me if this is going to be a little bit tricky, but I'm going to just stop this, and I'm going to see if I can hop onto the chat and see if I've got your the link. Let me just see if I can get this going. Let's see. So I'll just pop the link on the chat for you. I also see a couple of questions in here. So let me see. I will pop the link first for you, and then I will answer those questions if you're still around. You can now pop things around on the chat if you'd like, all right? Because I can now read the chat and I can answer your questions through there. I will answer them by just replying to them, explaining to you what it is, the questions that we're having, and then the answer. So let me see if I can make this work again. There we go. So I'll pop it the chat. In the chat, we've got. I'll pop down the link for the page where you can book your call. And now we've had. I'm sorry. I hope you've been able to fix the sound. I've got some people saying that the sound was not particularly good. So there's not too many questions around. There's one question about the average income in UK for general practice. So that question is, I'm going to reply with the average or with something similar to the average. The income really heavily depends on where you're located. And it depends on whether you're doing small animal, farm animal, equine, or mixed. Usually, entry small animal, you will probably be starting with about 30,000 per year, 30,000 pounds per year. In the UK, the salaries are offered per year. 30,000 per year is a very good salary to start with. In many places, you will not start at 30,000, you will start at 25,000. There's actually a post on the Facebook group about that. And it actually did some calculations about the average salary that you would get and how much money you actually take home. normally for small animal, you are looking at 25 to 30,000 as a starting point, and you can then hopefully evolve on that. We've had another question from M, which is about residencies, and it's asking whether an internship at a university is a requirement for a residency. So the answer to that depends on the residency that you want to do and the requirements for the college that you are looking to attend. So it is very common for residencies such as internal medicine and surgery and so on to require that the candidate has 1 year of experience in a referral environment, usually an internship at a referral institution, or some will accept 2 years of general experience provided, or rather 2 years of particular experience in the area that you are applying for. So you don't need to go through an internship at a university. There are practices, private practices that offer internships, and those are still considered internships at referral level, and they are still accounted for if you are registering and wanting to register for a residency. But depending on the residency, you will need to either have 1 year internship at a referral practice where you have seen cases that you will be working for, or the type of cases that you work with if you're doing a residency, or if you don't have an internship, you need to have experience, valuable experience in the area. So for instance, some people will apply for a residency after they've been working for several years, say at a university hospital that is not an internship and that is not based in the UK. So for instance, people that have worked for a couple of years at a hospital, at a university in a different country, such as Portugal, Spain, etc., they will sometimes apply for a residency and try to count their experience at an academic level, count as a requirement, the requirement that they have. But it really actually depends on the type of residency that you're getting. I have one more question that was sent to me privately, which is about the RCVS examination. That's from Busayo, who is not a European. He's from Nigeria, and he's asking if for the RCVS examination, if he has to be familiar with surgical procedures in different species. And for the answer for that is yes, but not necessarily for all species, because you can choose either a small animal, you can choose equine, you can choose farm animal, and you can choose food and safety. So if you choose a small animal, for instance, you have to be familiar with surgical procedures in small animal, but not in horses if you're only choosing small animal. And thank you very much, Luis, for your comment. And Victor is asking if you recommend recruitment agencies. That is a very tricky question to answer. In general, recruitment agencies charge a fairly hefty fee to the practices. So if a practice is looking for a placement through a recruitment agency, but if the practice also has its own advertisement, then the practice will likely be looking at people that apply through their own advertisement and not through the recruitment agencies. The recruitment agencies, like I said, charge usually a fee that is not really that cheap to the practices if they employ a vet, and therefore some practices are reluctant to accept candidates that are going through recruitment agencies because they have to pay 2 or 3 times the vet. So it can be good in some cases because they will sometimes have offers that are not being offered elsewhere, and they will sometimes work, or there will be clinics and practices that only work with recruitment agencies. So you don't have a way to get a job at them unless you go through a recruitment agency. But in general, if you are looking for a job yourself, my general suggestion, unless you have a lot of experience and you know exactly what you're wanting and you're comfortable with it, if you are just starting and you're looking for a job, I always tend to recommend, in most cases, that you look for a job yourself and you apply yourself, and not go through agencies. And again, that's just because some practices are a bit more reluctant to look at candidates that come through agencies. And the thing for you to be aware of as well is that the client for the recruitment agency is not you. The client is the practice. So the recruitment agencies are interested in placing you at a practice, but not necessarily at the best practice for you. So they will try to fit you in the best possible way, but sometimes they don't have exactly what you're looking for. And however, they will still try to get you to take that position. So there is no, I wouldn't say there's any harm in using recruitment agencies, but don't use just recruitment agencies. If you can, try to do it yourself as well. Okay, so that seems to have been the last, oh, not the very last question. We still have another one from M, which is about meat inspection. And unfortunately, I do not have that type of experience and official controls. There are quite a lot of, like you said, there are a lot of adverts from Evelyn Jones. And those are the guys that deal with the recruitment for these areas in the UK. And they do recruit in this area. Now, I don't have experience working with them, although I do know a couple of people, and probably Louise will know even more, that have started in this area. And actually, I think I might refer you to Louise, because I believe he has worked in the area, or he started in the area. But I have, the experience I have from other colleagues in that area is that they do provide quite a bit of support, and they offer quite a lot of conditions. They offer the training, and they help you with the training, and they pay for the training, as far as I'm aware, because you do need specific training to do official controls to become an official veterinarian, and they do that. If you are interested in that specific area, then those guys are the ones to talk to, because they are the ones that deal with all the meat inspection and all the OVs in the UK. They are the ones that recruit on behalf of the government, basically. So if that's your interest, go ahead. They are always looking for people. So it can be an entryway into the UK, into the RCVS registration. But really, if you are from a European country, you don't necessarily need their help to go through the RCVS examination. It's a possibility for other people that are from different countries. Exactly, like what Louise is saying, if you go with them, if you start with them, when you go to small animal practice, you're starting from scratch anyway. It doesn't give you a benefit in terms of experience, as far as I'm aware. It's not something that would be terribly valued, apart from the fact that you have been working and you are living in the UK, which is always valued. So I'll leave a couple of minutes to see if we can wrap it up. I will be trying really hard for you to get the the recording on your email. If that doesn't happen, please let me know. But by tomorrow, it should be uploaded and you should be receiving an email. And again, thank you very much for being present. Thank you very much for your questions. And I hope you gained some insights from this presentation. And I'll see you around, and probably for most of you, I'll be seeing you on the Facebook group. Thank you very much again.